10 signs and symptoms your blood sugar is too high. Having too much sugar in your blood, often called high blood sugar or hyperglycemia, is a common problem for people with diabetes. Surprisingly, even those without diabetes can face this issue when too much sugar piles up in their blood. It's crucial to notice when your blood sugar is too high. But before we talk about that, let's understand what glucose is and how it works in our bodies. Glucose is a substance we get from the food we eat. Our body needs glucose to go into our cells and become energy so our organs work like they should. Insulin, a hormone made in the pancreas, is like a key. It lets glucose enter our cells. Without this insulin, glucose stays in our blood, which can lead to serious health problems like diabetes. But remember, not every high blood sugar moment means you have diabetes. In this video, we'll explain 10 signs and symptoms that your blood sugar might be too high. Before we continue, all the information presented in this video has been verified, fact-checked, and reviewed by qualified health professionals. Be sure to watch until the end because there's one that I think will surprise you. With that said, let's get started and discuss 10 signs and symptoms your blood sugar might be too high. Number 1. Excessive urination. When your blood sugar levels are too high, your kidneys work to remove the excess sugar from your bloodstream. Sugar is filtered from the blood into the kidneys and then ends up in the urine. The kidneys, acting as filters, attempt to get rid of this excess sugar by producing more urine. As a result, you may feel the need to urinate more frequently, even waking up at night to use the restroom. This increased urination is the body's way of trying to lower the elevated blood sugar levels. However, it can lead to dehydration because you're losing more fluids through urine. Consequently, excessive thirst often accompanies excessive urination, a cycle where high blood sugar triggers excessive urination, causing the body to become dehydrated, resulting in increased thirst. Monitoring these symptoms is crucial, as persistent high blood sugar levels can be an indicator of underlying conditions such as diabetes that need proper management and treatment. Number 2. Weight gain. High blood sugar often accompanies insulin resistance, a condition where the body's cells don't respond well to insulin. Insulin is a hormone that helps glucose enter cells to be used as energy. When cells resist this process, glucose remains in the bloodstream, leading to high blood sugar levels. In response to insulin resistance, the body tries to compensate by producing more insulin. Higher levels of insulin can lead to weight gain, specifically an increase in fat storage, especially around the abdomen. Insulin resistance and elevated insulin levels can affect metabolism, making it easier for the body to store fat and harder to burn stored fat for energy. This contributes to weight gain or difficulty losing weight. Number 3. Excessive thirst. When blood sugar levels are high, excess glucose builds up in the bloodstream. Glucose is an osmotic agent, meaning it draws water into the bloodstream. The elevated glucose levels create an osmotic effect, pulling water from the body's tissues and cells into the bloodstream, leading to increased blood volume and dehydration of cells. The excess glucose in the blood prompts the kidneys to work harder to filter and remove it through urine. This increased urination, known as polyuria, results in the loss of a significant amount of water and can quickly lead to dehydration. Dehydration triggers the body's thirst response, making you feel exceptionally thirsty. The body's way of trying to compensate for the fluid loss and rehydrate is by signaling a strong urge to drink water, resulting in excessive thirst. Thirst is regulated by a complex feedback system involving the brain and hormones. When the body detects dehydration due to increased glucose levels and subsequent urination, it signals the brain to stimulate thirst to encourage fluid intake. Number 4. Blurred vision. High blood sugar levels can cause changes in the fluid levels in the body, including the lenses of the eyes. The lenses can swell, affecting their ability to focus and resulting in blurred vision. Elevated blood sugar levels can lead to an osmotic effect, drawing fluid from the body's tissues, including the lenses of the eyes. This change in the shape and structure of the lenses can cause visual disturbances. Over time, chronic high blood sugar levels can damage the blood vessels in the retina of the eye, a condition known as diabetic retinopathy. This can affect vision and contribute to blurred or distorted vision. High blood sugar levels can cause a fluid imbalance in the eye, affecting the shape of the lens and impacting its ability to focus properly, leading to blurred vision. Number 5. Weak immune system. High blood sugar levels, especially over an extended period, can impair the functioning of the immune system. The immune cells, which defend the body against infections, may not function optimally when there's an excess of sugar in the bloodstream. Elevated blood sugar levels can impact the white blood cells responsible for fighting off infections. These cells may not be as effective at identifying and neutralizing pathogens when blood sugar is consistently high. Individuals with consistently high blood sugar levels are more susceptible to infections, including bacterial, fungal, and urinary tract infections. The immune system's weakened state makes it difficult for the body to fight off these infections efficiently. For people with diabetes, managing blood sugar levels within a target range through proper medication, diet, exercise, and lifestyle modifications is essential to support a stronger immune system. Liking our video so far? Before we moved on to the next science, don't forget to hit that like button and subscribe to our channel, so you never missed out on new informative videos. Number 6. Fatigue. Glucose, obtained from the food we eat, is the primary source of energy for our body's cells. Insulin helps glucose enter these cells, where it's converted into energy. In high blood sugar situations, either due to insulin resistance or inadequate insulin production, glucose can't efficiently enter cells to produce energy, leading to fatigue and a feeling of low energy. In insulin resistance, the body's cells don't respond effectively to insulin, resulting in reduced glucose uptake by cells. Consequently, glucose remains in the bloodstream, unable to provide energy to the cells, leaving the person feeling fatigued and low on energy. Proper diabetes management, including lifestyle changes and medication, can help alleviate fatigue and improve overall energy levels. Number 7. Abdominal pain. Abdominal pain is not typically a direct symptom of high blood sugar. Instead, it's more commonly associated with conditions related to diabetes or its complications. High blood sugar levels over a prolonged period can cause gastrointestinal issues, including constipation, diarrhea, bloating, or cramping. These gastrointestinal disturbances can lead to abdominal discomfort or pain. In some cases, diabetes can cause a condition known as gastroparesis, where the stomach takes longer to empty its contents into the small intestine. This delay in digestion can cause abdominal pain, bloating, nausea, and a feeling of fullness. Diabetic ketoacidosis is a severe and potentially life-threatening complication of diabetes, often associated with very high blood sugar levels. Symptoms can include abdominal pain, nausea, vomiting, and a distinctive fruity breath odor. Number 8. Tingling and numb hands and feet. Tingling and numbness in the hands and feet can be a sign of high blood sugar, particularly in the context of diabetes or uncontrolled blood sugar levels. High blood sugar levels, especially when consistently elevated over time, can cause damage to the nerves throughout the body. This condition is known as diabetic neuropathy. Nerve damage often begins in the extremities, such as the hands and feet. The tingling and numbness are early signs of nerve damage. High blood sugar can lead to damage in the small blood vessels that supply nerves. This reduced blood flow can cause nerve dysfunction, resulting in sensations of tingling, numbness, or a pins and needles feeling in the extremities. High blood sugar can damage blood vessels, leading to poor circulation, especially in the extremities. Reduced blood flow can affect nerve health and cause tingling and numbness. Number 9. Dark skin patches. Dark skin patches, often referred to as acanthosis nigricans, can be a sign or symptom associated with high blood sugar levels, particularly in the context of insulin resistance or diabetes. Insulin resistance is a condition where the body's cells don't respond effectively to insulin. In response, the pancreas produces more insulin to compensate. Insulin resistance is commonly associated with obesity and higher body fat, especially around the abdomen. Excess insulin in the blood can trigger the growth of skin cells, leading to the appearance of dark, thickened patches, usually on the neck, armpits, or groin. Insulin resistance and high blood sugar can disrupt the balance of hormones in the body, including insulin and related hormones. These hormonal imbalances can contribute to skin changes, like dark patches, as a manifestation of the underlying metabolic issues. High levels of insulin and insulin resistance can stimulate the production of skin cells and the release of certain growth factors. These factors can cause an increase in skin pigmentation, resulting in darkened patches on the skin. Number 10. Mood swings. Mood swings can indeed be a sign or symptom associated with high blood sugar, particularly in individuals with diabetes or those experiencing significant fluctuations in blood sugar levels. Glucose is a primary source of energy for the brain. When blood sugar levels are elevated, excess glucose can disrupt the brain's normal functioning, leading to changes in mood, concentration, and cognitive performance. High blood sugar levels can trigger hormonal fluctuations, including an increase in cortisol. Elevated cortisol levels can contribute to feelings of anxiety, irritability, and mood swings. Rapid spikes and subsequent drops in blood sugar levels, common in individuals with uncontrolled blood sugar, can affect mood and energy levels. The highs followed by sudden lows can lead to feelings of irritability, frustration, or even sadness. High blood sugar can affect neurotransmitters, which are chemical messengers in the brain that regulate mood and emotions. This disruption can contribute to mood swings, ranging from anxiety to depression. Elevated blood sugar levels can interfere with sleep quality and quantity, leading to fatigue and mood disturbances during the day. Lack of proper rest can significantly affect mood and emotional well-being. Managing diabetes and dealing with the challenges of blood sugar control can be stressful and emotionally taxing. Stress and anxiety related to managing a chronic condition can affect mood and lead to mood swings. Addressing mood swings associated with high blood sugar involves proper management of blood sugar levels through medication, dietary adjustments, regular physical activity, stress management techniques, and a consistent healthcare regimen. It's important for individuals experiencing persistent mood swings to work closely with healthcare professionals to achieve stable blood sugar levels and improve overall emotional well-being. Thank you for joining us on this insightful journey into understanding the signs and symptoms of high blood sugar. Knowledge is key to a healthier life, so if you found this information helpful, make sure to give it a thumbs up and share it with your friends and family. Don't forget to hit that subscribe button and ring the notification bell so you never miss out on our health and wellness updates. Stay safe and healthy, and we'll see you in the next video.